Next up, this is our last panel of the day, and it's been worth waiting for. We're going to get a global perspective. This brain economy movement is spreading all across the globe. There are wonderful pockets of people making impactful work happen. This panel will be hosted by Jeff Merritt. Come on up, Jeff, and the panel here. Harris is on his way. Jeff Merritt is the head of urban transformation at the World Economic Forum, and he is a global leader in urban innovation and economic development. Jeff brings together governments, investors, and industry to scale solutions that strengthen cities and improve quality of life. And with that, I'm going to turn it over to Jeff while we have our global panel.
There we go. You guys hear me? I love when you look up here at the names and the lists of sort of titles that everybody here has. This is a group here that has achieved a lot, has seen a lot around the world, and I'm not going to let them off easy here today. My goal is really sort of on behalf of all of you to push hard to get into the sort of real weeds of what's happening. Because over the course of today, we've really looked at this issue of the brain economy and brain capital from all these different dimensions, whether we're talking about brain development or workforce or investment in aging. It's very clear that something is happening here, and I think what I want to dig into here is what exactly is that? Because we know, and we've heard the word, how many times the word AI come up over the course of the day, right? We are living in extraordinary times from a technological standpoint, an economic standpoint. When you look at the newspapers today or your media of choice, we see that Anthropic rolled out a new model. We see a whole lot of talk about all of this change happening, but we're not seeing talk about the brain economy. Right, we're seeing hundreds of billions of dollars in investment going into AI. We're seeing national AI strategies being developed by almost every government around the world. We're seeing companies that have been around for, in many cases, well over 100 years that are rethinking their entire existence. And then here we are in Houston, Texas, about 600 of us that are really talking about a counter movement, or as Joshin said earlier, a bit of a complement or an antidote to that. And I think the question that we all really need to understand and ask is, are we seeing the beginning of a global movement? Is this genuine? Is this real? Or are we actually just participating in our own hype cycle, right? And we need to really be asking that, because if we're not getting into the details here, it's very easy to find ourselves in a situation where 5 years from now, we're still having this same discussion. So we're going to dive in here with this group, looking at particular places around the world, what's happening on the ground, and understanding what's driving that, what are the unique elements, and how can we all together sort of rally behind this and make sure it's something real. And I want to start at the end. I'm going to start with Canada here. And Elizabeth, you've really been driving this work in Canada to build a very impressive coalition that's cross-industry, cross-sector, to build out a national framework. Can you speak a little bit about what's happening in Canada? Why should this audience care? What's really unique about that?
Hello? Is that working? Okay, yeah, so just as by way of quick introduction, I'm Elizabeth Allen, and I am driving the Brain Economy Initiative in Canada. I am currently housed at the Canadian Centre on Substance Use and Addiction, which is a national health organization, but I'm also on loan from the federal government. So my home position is at the Privy Council Office, which is the department that supports the Prime Minister. And so my approach that I'm taking is really very much that national policy view, but working in close collaboration and convening the ecosystem across Canada, which is very active, very interested, And I think there's a lot of great things going on that I'm looking forward to showcasing. I do have to start, though, by saying that, of course, the brain capital concept is a made in Canada concept from the late 2000s, from the late Michael Wilson. And so this was, came out of a big mental health initiative that he had spearheaded in the private sector. So brain health plus brain skills. And so we like to claim that as modest Canadians. But what is happening in Canada? So I want to talk a little bit about the context. I won't spend too much time on it, but we do have a wonderful new Prime Minister Mark Carney, who came into office about a year ago, and our previous Prime Minister, Trudeau, was very social focused and social oriented and put in a lot of great policies during the pandemic. One of them is a brain economy policy that I like to hold up, which is National Early Learning and Child Care Program. And I call it a brain economy policy because it was successful only because it looked at developing the brains of young children, but it also had a goal of keeping and attracting more women into the workforce. And so it had an economic and a social lens. We now have a new Prime Minister who's very focused on the economy. The last budget that we had is called Canada Strong, and it's all about building a stronger Canada through infrastructure projects, increasing our GDP through AI investments, and tackling a lot of the issues that we have right now, which I think are really relevant. And brain economy is a very eloquent solution to those issues. It's a bit of a polycrisis, right? We have social issues, environmental issues, economic issues, all coming to a head. Same issues I think that most countries around the world are facing. We have affordability crisis. We have food insecurity. We have housing affordability issues, inflation. So there's all these compounding effects that are putting real pressure on Canadians. And the brain economy, I think, substance use as well. Declining mental health. Between 2015 and 2025, self-reported mental health dropped from 72% to 53%. And that's pretty significant, right? So the trends are going in the same direction, and we really are mobilizing sectors, research, substance use and addiction, mental health, healthcare, all of these sectors across the country to come together in that systems approach. When you have complex problems like a polycrisis, you need a systems approach to attack it, and I think that we're really doing a great job of collaborating to make some progress on that front.
Thanks. Let's move across the pond to Europe here. And Paula, you've been leading a lot of incredible work in Europe on sort of the innovation agenda there and this work around brain economy. But last year, some of the news in this sort of health space that came out of Europe was about the the Safe Hearts Plan, right? It's this sort of the first EU-wide comprehensive approach on cardiovascular health. And I think that's a great sort of sign of what's possible when the EU comes together, that they can really rally around a health crisis and drive change. I'm curious whether or not you're seeing a similar sort of polycrisis and sort of movement in the direction of brain health, or sort of what it might take, or where we're sort of seeing that sort of towards that inflection point on brain health.
Brain health is definitely up and coming in Europe, but we do like one thing at a time. So it's been cancer before, it is cardiovascular in the current political term, and by political term I mean the term of the European institutions. So that's another 3 years. But the brain is next. So the good news is that we can spend this time to design the policies that will be hopefully endorsed at that time, because we do have Brain Health Partnership that has just been launched. That's a 500 million euro program, 35 funding agencies, 30 countries involved. So there is a lot of stuff going on. But the big focus on the brain will come after 2029. And we need to be able to say what that focus should be all about. So I think it's actually good news that we have a little bit of leeway to design that policy going forward. And that really, to me, speaks to one of the key functions of the brain economy concept also, because I see the brain economy as enabling three things. One is the being a moonshot catalyst, so allowing us to think bigger when we need to think bigger. And we've heard a lot of things today about what needs to be done, but I think we still need to gain this escape velocity in our community and have the level of ambition which will give all the evidence that we have the merit it deserves. So that's being a moonshot catalyst. When we asked that question at the recent European Brain Economy Summit, what should be the moonshot in the brain field, someone said, world without dementia. And I think that's exactly the type of thinking that we need to adopt. The second faction, very quickly, is as a plumbing device. And I say plumbing device because we have heard in the previous two panels that health systems do not work very well, to put it mildly. And we need to be very open and honest about what needs to be addressed. And the third function is that of a connective tissue, and that gets straight to the introduction that you made about AI and our cognitive welfare, which is becoming a major theme in many conversations and probably a defining question for this decade. So for me, the role of the brain economy as an interdisciplinary concept is really threefold: to get us to the right level of ambition, to provide for this connective tissue, and to be open and honest about the different difficulties which we need to overcome, because systemically things are broken in many places and they need to be fixed.
Now, George, turning to you, you founded the Davos Alzheimer's Collective. You've been one of the sort of leading global advocates on this issue for many years now. And I think what was really interesting in some of our early conversations is you've been doing a lot of work in the global south and the developing world. And I think a lot of people in this room, probably the general public, think that innovation oftentimes flows from sort of wealthier nations sort of into the developing world. But there may be some sort of really sort of valuable insights and learnings that hopefully we can start to move the other way. I'm curious if you can speak a little bit about what you're seeing emerge right now and sort of happen on the ground in, whether it be Africa or India or Latin America.
Let me just take a point of personal privilege first. We did a conference here in this room last year. It was half this size, less than half this size. And it was basically to try and introduce brain health as a business issue. So I think at the time, the person that ran this was Kelly O'Brien, and I don't know that she's still here, but she deserves a real shout out from my organization. With that said, David Gao has taken that sort of idea and nudge and turned it into real action. And it reflects the sort of the energy in this room and the diversity and number of people in this room who are driving this to a concrete stage in Houston and demonstrating that place-based approaches can start bringing together a wide variety of people around this common narrative around the brain. So I want to give a lot of shout out to David Gao and to Jochen Reiser, who'll do tomorrow's session. Davos Alzheimer's Collaborative was launched in 2020, January of 2020. You might remember that that was the first month before COVID. So for a period of time, the world turns its attention to COVID, but more people died of Alzheimer's during that period than ever died of COVID. So the sense of urgency of infectious disease is an almighty strong driver. But what we saw during COVID and with the reaction to COVID was that we developed vaccines in the north, and maybe they got to the global south if we had some left over. So that what happened is that in 2019, I got called by the then head of the World Economic Forum, Klaus Schwab, who said, I believe that Alzheimer's was going to be the social and economic equivalent of infectious disease or even greater in the coming years. Now, why did he make that observation? 70 to 80% of the cases of dementia and Alzheimer's are not in the global north. It's not in this country that this is a big problem. It's a big problem, but it is a huge problem in the global south. The number of people turning 60 in the global south over the next 20 years is well over 1 billion people. The number of people globally that now have dementia, now full-blown dementia, 55 million people. There are another 20 to 30 to 40 million people who have MCI, and an estimated 400 million people who have the pathology of the disease in the global south. So we're talking 500 million people today that have the disease or are on the path to it because they have the pathology. And so that is going to triple in the next 20 years. So the global south is confronting this problem of two demographic issues: a growing older population without the specialists of neurologists, without the equipment to treat this disease the way that we think that it should be treated in this country, and really no health system really to support what we would think of as a good health system in the United States, which we now know is not particularly good, but in fact it is at least more financed better than it is in the global south. The other demographic fact for the global south is that they have a bolus of young people. This is an aging population in the United States, an aging population in Europe, but a young population globally as well as an aging population. So we go to the global south and we say, let's talk about brain health. They say, we want to talk both about the aging population and how to prevent the onset of Alzheimer's that we're going to see, and the fiscal crisis that it's going to create, the increased debt that we're going to have to incur as governments in order to sustain the additional supports that we're going to have to give to our people. We can't sustain our debt today. That particular line of analysis leads us to the World Bank, and that leads us to multilateral finance institutions of how to think through a 20-year plan to prevent this huge bolus of late life and aging disease. At the same time, we want you to focus on our young people. What are the signs of brain resilience? What is it that we have to do with our young people today to be able to make them the workforce of the future, to provide the economic growth that we need in the future? So for the global south, this is a fiscal issue, a debt issue potentially, and it is also an economic development issue. So it's worker productivity, it is economic growth, it is social sustainability of their countries, as so many women are drawn into the caregiving role in the global south, whether it be for what we call today mental health, what we call today neurodegenerative disease, what we should be calling brain health, which is what David Gao has changed the conversation, I think, today to make this a brain health issue. But the global south is confronting different issues, which means different solutions. We can talk about what the different solutions are, but that's their problem. And so we'll need different solutions for them.
Thanks. Harris, you know, if Elizabeth spoke about Canada and Powell spoke about Europe, and we've heard from George about sort of the global south, I'm curious, you know, in your work with the Global Brain Economy Initiative and looking across regions, are there sort of places that should be on our radar that perhaps aren't, that are doing some interesting work that we should be aware of, and then maybe we should be sort of rallying around or elevating?
Thanks for the question. Interestingly, there is a national Malaysian brain economy science strategy being developed. So who would have thought that in an area like, you know, in Southeast Asia, Malaysia, middle-income country, they're doing a science strategy for the country at the national level. So I think we have a lot to learn from that, and the people that are leading that are informing us and vice versa. That's very impressive. Also, the First Nation, on the First Nation side, it is fascinating that in Australia, there is an organization called Yilia Pinya First Nations Corporation that is driving a brain economy strategy in local Indigenous communities in Australia across the lifespan, managing issues of maternal mental health, brain health, first 1,000 days, all the way through to working age adults and dementia prevention, and looking at food systems, health systems, education systems. So those are two fascinating geographies that you wouldn't think about that are driving very unique work. And to George's point, we we look to sort of learn not just what we can teach other sort of lower resource areas, but what they can teach us and keep us on our toes as well.
I want everybody to help me understand why now, right? We're seeing something that appeared as really interesting across the world. We're seeing different efforts sort of sprouting up, and there's some different drivers here, right? It seems like in Canada there's an economic driver, in the South, global South, a demographic driver, and sort of a look to the future and debt. In Europe, it's in some ways almost a bit of a strategic plan sort of progression here. But why are we seeing this? Harris, jump in. What's happening here?
I think Arthur made a great point before that AI is the biggest experiment ever conducted on the human brain, and I think he should write an op-ed about that in the New York Times or something. I think it's AI, is my opinion, that as Rim Ayati showed, global brain capital is declining, essentially, and AI is stressing us massively, our brains, in many ways. And so we have an existential, human scale, civilization scale problem that our brains are not ready for the moment. And we're now seeing a big backlash, an AI hate wave. And so I think that why now is that because this is a big problem. It centers around the human brain, and we must find a way to not make this AI economy brain negative, but make it brain positive, make it work for us, and keep humans in the driver's seat, and keep humanity and the humanities in the driver's seat. And so I think that is why we're getting so much attention, and it's incumbent upon all of us to figure out what to do strategically. And interestingly, this event is held in the context of the American presidency of the G20. So I want to make this a G20 priority, but putting the brain and the brain positivity in the AI economy that many national governments are driving and the business community is driving.
I'm going to add demography. I think the prevalence of these diseases and the cost of these diseases. When we talked to Washington, and we spent 15 years building a bicameral, bipartisan coalition to invest in these diseases at NIH, it was because the cost of the disease to the federal government was rising rapidly. And they said, we went in with a one-page chart, which was, this is the cost to the United States government, and we can project it out. And it's measuring, at the time when we started, 250 billion, now closer to 400 billion, and you're spending 400 million against that cost problem, you should be fired as a CEO. You're an economic actor here in which you're spending $400 to $500 billion, estimated by mid-century to be $1 trillion, more than the Defense Department. Although we're trying to raise that, I recognize too. But at least at the time, $1 trillion was thought to be a lot of money on these diseases. And you're not spending to try and prevent them. So fire you. And they got it. And the Republicans have been driving this over time. Now, this particular Republican administration has been trying to cut that back. And that now we're in a sort of a defensive fight. But if you look at Texas, the decision made here to do DPRIT was driven by Medicaid costs to the state government, and they wanted to prevent the dementia that was causing increased rises of costs here to the state. Mental health costs in this country are rising, and we have no clue on how to reduce them because we can't get treatments that are effective that are reducing mental health crises. So I think it's demography and the prevalence of and the costs associated. Certainly seeing that in the global South. So I think that is a driver. I do not disagree with Harris that AI is a catalyst to how to think differently about the brain. But I think the driver for politicians right now is the fiscal crisis.
Bending the cost of disorders is foundational, and it can be done. When we look at some brain disorders like multiple sclerosis, we can see that the curve is being bent. 30 years ago, there was no medication for MS. Today, there are 30, 40 FDA-approved drugs, and there is a change, right? We are managing the disease, and we're moving towards a situation when MS is to be seen as a preventable disease as well, because we know some of the factors leading to it. Epstein-Barr virus, vitamin D deficiency, genetic factors, these are the three main issues. We can do a lot on 2 out of these 3, so the disease becomes preventable. I'm giving this example because we tend to focus on dementia, where the curve is not being bent, far from it, and the cost is projected to triple by 2050. In order for us to see that this is the moment to take bold action, because also the lessons learned from the MS experience is that you need to take bold action. You need to go towards high-efficiency treatments, apply them early, and this is how you stop the disease from doing damage. So this is the foundational challenge, but we do have a convergence of factors because clearly the transition that we are experiencing towards ever greater use of AI is unparalleled. We did have a transition from verbal storytelling to book reading. Our brains also had to adjust. We lost some of the acuity with regard to reading the world, but we did adapt. Now this is happening just so much faster and on a much greater scale. And it's an open question whether this will be the liberation moment for us, that we will take things into our own hands and we will regain the cognitive liberty that we all want to have and all deserve. But again, this definitely adds to the importance of this junction. And to finish, I think the idea of brain positivity is really the most inspiring that we can have, because brain positivity ultimately implies that we have our destiny in our own hands, and that we understand the confluence of factors that affect our brain. And today's discussion has been a testament to how important these are.
Elizabeth, I want your thoughts on Harris's point here, because on one hand, it makes sense, this sort of AI pushing us in this direction, but I can tell you in all the governments that I'm working with on a day-to-day basis are telling me how to attract and build data centers faster, how to think about changing, their permitting process, their building more capacity in their energy grids. That's where the economic driver that I'm seeing right now is, because they're trying to capitalize on the flow of investment. And so I'm curious, when you speak about some of the sort of economic drivers in Canada, who are you seeing kind of push that, and how strong is it?
And so by pushing that, you mean the AI piece or the brain economy piece?
The brain economy piece.
So I'd say, since I've been involved in this initiative, which I started last October, there were a lot of early adopters in the Canadian space from a science, research, health perspective. And so we've been working very intentionally on widening that out more broadly to businesses. So the head of the Canadian Chamber of Commerce, for example, we met with her in April, and she's super keen on this, because I think people across all sectors see the benefit of it. And so whether we're speaking to our federal department responsible for AI governance and policy, or whether it's building mines in our remote northern regions, everybody is seeing the opportunity here to bring that the people element into it and the health into it. And I think where we really get people is where we can say, well, we're already doing this. So it is a little bit of that, the social responsibility. If you're building a mine in the north and you're disrupting a community, well, you're bringing your wealth with you, and you're expected to invest back into that community, right, for brain health. And if we can talk more about that and showcase that more, it becomes very compelling. On the substance use and addiction front, the community level work is getting a lot of traction, because we know that place-based approaches That's where everything's happening. And if we can get the system together, the CCSA has a great, phenomenal initiative they just released called the Small Cities Initiative, which brings law enforcement and public health and businesses and everybody in the ecosystem together to find solutions that make sense for the community to solve the toxic drug crisis or substance use issues, which also deals with mental health and housing. So I think we're demonstrating to decision makers that there are solutions here that are brain health solutions, but also have economic value. And we're really reaching into those regions across Canada. For example, Hotchkiss Brain Institute in Calgary has done a lot of work with Houston. They're doing some great, they have their own strategy on brain economy. And we're really looking at it from that whole brain economy approach where it's health and business and economy together, looking for outcomes that benefit both our economy and the health of our people. And if I may just say one quick other thing, because we've talked a lot about prevention and the challenges with prevention. And from a kind of a national policy, political perspective, and it's been mentioned on the previous panels today, of course, we can't see far enough ahead, right?
Yeah.
Nobody really wants to invest in something they're not going to see the outcome for another 10 years. And so I think by maybe really focusing on those early wins and what's happening and what the potential is in the immediate term, while trying to demonstrate in the meantime or collect the data and the evidence base for the longer term, we may have a better shot at succeeding at this in Canada.
I'd love to dive into that because I think one of my takeaways from today was actually, Arthur, your comment earlier about the lessons learned from social media, right? And we talked about this so much about the harm that was being caused. We were seeing it in the news again and again, and we somehow sat, idly watching as this grew. And I'm curious to this point that you made, Elizabeth, to what extent can we be proactive and drive some wins here that begin to put maybe some wind behind our back here and push us forward versus waiting perhaps for a crisis of the kind that you mentioned, George, like someone, bankruptcy and debt crises and all of these things, which may take a much, much longer period of time. I'd love thoughts from the group on sort of what can be this sort of forcing function to make sure that this actually develops into something meaningful, whether that's at a sort of very micro place-based view like a Houston, or if we're talking at a national level or even global level.
So let me, you asked me the question earlier about what the innovative solutions coming out of the South are.
Yeah.
Well, one of the unusual characteristics of the South, given global surveys of mind health, is that the best mind health in the world is sub-Saharan Africa. Multiple generation families, strong spiritual values, strong community values. Everybody's kids, that there's a strong effort there. So the force in the South is basically, how do you reinforce in a world that has some pretty strong cultural values, how do you use new technology to actually rely on that? So one of the things we've found is an African Brain Digital Initiative, which is in fact going to be cell phone-based means of detecting cognitive and mental health through call-out mechanisms and voice technologies, validating that across widely diverse populations of Africa, Latin America, and Asia, but then actually using the cell phone and chatbot technologies to deliver services. And so you can design those in a way that very much is in your parent's voice or talking to a family in their own voice about this issue to get the conversation going. So there are new the technology is our friend in the global South, in a sense. We are using AI, Fingerprint AI company, to basically do this on an individualized basis, based upon data that you collect through time. But technology is our friend. So the global South has this need to respond to its particular cultural setting, its particular need for low cost and highly distributed settings rather than a hospital-based system, very much community health worker basis. Lower costs of means of diagnosis, voice-based off of a cell phone is the most easiest one, but we're looking at other things like smell technologies, olfactory interventions, that in fact are very, very low cost means of detecting disease and actually treating disease. Olfactory interventions, because we know that in fact the sensors in your nose, believe it or not, turns it into electrical signals that go right to the hippocampus of your brain and improve the brain circuits that deal with memory at the same time as you're smelling something, depending on the scent. And so we have to find new solutions there. Vaccines will drive this. We have initiative with regulators and academic scientists and companies on how to develop low-cost vaccines, whether it's a shingles vaccine or a pneumococcal vaccine or a tuberculosis vaccine or, in fact, innate immune system vaccines. Vaccines can be used in the global south. The things that we're developing in the global north with monoclonal antibodies are not going to ever be affordable in the south. The other thing the south has to do is population-based interventions on sort of the risk reduction scale. So looking to now off-patent GLP-1s manufactured at scale at virtually no cost to the consumer or to the health system, potentially funded with a clinical care system that's improved and built by financing from the World Bank or the multilateral banks, so that we find ways of delivering this. It is much, much more low cost, much more accessible in much more rural or remote settings, and using technology and at the same time using very low cost techniques to diagnose and treat patients. So we're going to find lower cost solutions which may be much more appropriate for lower cost segments of the global north. So we're going to learn from the global south over the next 5 to 10 years, completely different solution sets to the diagnosis and treatment of these diseases or prevention of these diseases.
I want to go back to my three roles of the brain economy concept. So first of all, I think we need to call a spade spade. Namely, we have a market failure in brain health. We have a huge underfunding. United Global Mental Health estimates $200 billion US dollars of underfunding. Cost-effective interventions, which are evidence-based, are not attracting investment. One company, Onward Medical, that works in spinal cord injury, scaling fairly nicely. Stock is 40% down this year. Why? Because market expects immediate returns, while innovation in this space requires time, requires patient capital, and we have too little of that still available. So we need to do this plumbing that I mentioned at the beginning. Then we need the connective tissue, and here I think team intelligence that we heard about from Google XI, CogniGuard that we heard from Haim earlier, that would guide us how to use AI tools and when to rely on our own cognitive abilities. I think this is the trajectory. And then the final one is the moonshot accelerator, so to say, because everything we're doing, I think, is still too little too late. It's great promise, but I strongly believe we need to have a greater level of ambition. We need to define the real tipping points to addressing the brain health and brain economy challenge, and that will take a moonshot.
So if we're going to make this sort of commitment here as a group that we need to push towards this tipping point, I'd love if each of you can share one specific thing that the folks here in the room might be able to help do to sort of push us in that direction. What's something they can sort of rally around, or where you could use their help? Because we've got an incredibly diverse group of folks here, but I think the challenge when you have a diverse group of folks is that we can be oftentimes working in our silos and not actually kind of working in a common direction. So welcome the group to sort of jump in here with any specifics that you think you'd love their support with.
I think where we are in Canada right now, and developing a framework and a national strategy, it really, what is really valuable to us right now is the collaboration and the learning and the shared best practices and the partnerships. And just keeping that going so that we can help others, but also have others help us to find solutions.
I think there's two things that would be extremely catalytic. One is that we need a head of state to get behind this. We have engaged with health ministers and science ministers, but we need a head of state. And so that's a request to the crowd. Let's go call up your head of state best friend that you went to
He's
college
speaking
with.
tomorrow, right?
Well, I mean, Mark Carney would be wonderful because he does represent someone that would get this, and so that's on you, Elizabeth. But so I think that would be very catalytic of an economy of the scale that will get attention. We have very much engaged with the president of Cameroon in West Africa, which is wonderful. We had 33 ministers, and the president signed a declaration about the brain economy, so that was great. And now we need to keep going up to larger scale economies. But the second thing is this gets to tomorrow, we need to come together and figure out a big coordinated financial engine to invest in this. And there's a couple of banking and finance people in the room, and they're going to get up and speak tomorrow. And there's a bunch of venture capital tomorrow, but I think some sort of financial entity that is deploying real money and getting real returns is going to, we got to just start deploying money basically into solutions that can scale.
I'm going to pick up on Elizabeth's theme. When we did Brain House at Davos in 2025, we had about 4 sessions. We brought in investors, we brought in World Health Organizations, we brought in all these different players. And there was a headline in Fortune that said brain health is now on the global map. This year at Davos, there were like 20 sessions. The momentum behind this movement is great. What we need out of Houston is how did you take that movement with all its disparate elements and in a place-based way, bring them together to demonstrate progress on the ground, so to speak. And I think David has a great model here. And I think over the course of the next year, I think demonstrating that that model works, being respectful of the fact that we're going to be doing this in all places of the world, but we're all going to look to Houston about how it is that you've done it here, what worked and what didn't work in bringing disparate elements of a well-heeled, well-financed, well-brained community together to solve scientific and research and investment and health system problems and bring it together. Because if you can do it here, you will have taught the rest of the world something. And as we roam our different jurisdictions around the world, we can come back and say, this is what we learned somewhere else. But having this constant conversation with Houston, what's working, how's it working, how you bring people together, how do people respect each other, who is working together, who's not working together, and respect the fact that you may do things here that we may not do in Europe or in the Global South, but maybe the Global South has something to offer itself back to Houston. But having this conversation, but recognizing that Houston is right now the lead model on how a place-based system can bring together quite disparate elements across the entire value chain of research to actual delivery to patients and improving people's lives. And so I think Houston, if you do your model well, is going to teach a lot of us around the world on how to do it.
In my wish would be that this impressive group helps us define the framework for the brain positive organization, be it a company, be it an institution, be it a nonprofit. Because we need something rigorous, something which is evidence-based. We had lots of insights during the day, but we need a framework. We may need a certificate as well of a brain-positive organization, because we definitely have to rely on something inspiring to take this message forward. And having a brain-positive organization, a little bit like the B Corp framework, which exists and which works well. So B plus Corp framework. I think this is what a group like this could help to shape up.
Okay. Well, I hope you all found this sort of helpful. What I really ask you, don't forget that a year ago, Project Metis was just an idea. Now it's a strategy that's moving forward. You know, the hope here is that when we come again together next year, right, that we can have these very tangible signs of movement here that are moving forward. And so really, as we go into this sort of reception and then tomorrow, really ask yourself what you can do to lean in, whether that's here in Houston with Project Metis, or it's in your hometown and your country where you're from, that this will take all of us leaning in, and I'm excited to be part of this on this journey with all of you. So thank you.